Good morning. Welcome to Therapeutic Exercise and Theory. My name is Emily Bruton Pedersen. I am a physical therapist here in the Ukiah Valley. I've lived here for about 3 years, and I came from the Bay Area originally. I've been practicing as a PT for about 5 years and started teaching last year at the college in human biology. And for the past year-ish, I have been creating this course with a lot of help from others. And so you guys get to be the guinea pigs, as I'm sure you're learning. And so there will be lots of changes and feedback, but hopefully we will get through this during the craziness of coronavirus, and hopefully we can make it profitable and a great learning opportunity for you. Just a heads up for this class, there is a lot of reading, and I've gone through and tried to reduce the amount of reading as much as possible, but so much of the content in Bandy and Kolbe and Kilsner are just imperative to your understanding of therapeutic exercise. When we talk about exercise, what you might think is that we're having a class with a bunch of exercises, and there will be some exercises done in the lab. But essentially, this class is the intervention part of what you've already learned in applied kinesiology. And so this definitely has more of an outpatient kind of clinic feel as far as, okay, you have someone with this injury, what do you do? And the biggest thing that we'll be focusing on during this class is why. Why do you do that? How do you justify it? What's the point? And what makes it therapeutic? So what's the difference between a personal trainer and you? Or what's the difference between someone looking at a YouTube video and instructing a YouTube video versus you working with someone with a specific rehab protocol, following a surgery? How is that different? And so we'll be looking at tissue injury, and we'll be looking at different types of exercises. And the theory part and the reading and the theory and the modules are all basically why. Why do we do what we do? How do we do that? And then the lab will be the clinical application of that, where you guys will be able to critically think through things and develop your own therapeutic exercise programs. You'll be exposed to things, but then you'll also be expected to look at other resources to figure out, how do I design an exercise program for someone with an ankle injury or for someone with a rotator cuff repair? When I don't, and when I'm not given rehab protocols by surgeons, which, let me tell you, is very, very rare when I actually get something from them, how do I design a rehab protocol that is appropriate? And you will have physical therapists who initiate that, but oftentimes PTAs are the first person to see someone after an evaluation. And when someone has 40 to 60 minutes to complete an entire evaluation, progress note, they're not going home with a huge list of exercises. So on their second visit, they're coming to see you, and you have to figure out what is appropriate, what works. And you have to justify those exercises as well as know what is too much and what is too little. So there's a little introduction to the class. I think we're going to have a really good time. I'm really excited about this, and I look forward to meeting you guys on Thursday. Just a quick thing. If you haven't got your books yet, I would definitely look into getting those as soon as possible. Look at the introduction module and module 1, because those are actually done on time. And get started on the reading, just because the first week there will be a lot of reading. And it'll be really important for you to know those things prior to lab. Okay, see you guys soon.